The first most common cause of infertility relates to a female patient's age. So many women are deferring childbearing for good reasons. They have wonderful and meaningful professions. Perhaps they haven't met a significant other, or perhaps they want to conceive on their own. But that said, unfortunately, the biology for us as women is not kind. For us, we're actually born with all of the eggs that we're ever going to have, and that number of eggs declines with time. So very often I'll see patients that have a lower egg count as assessed by some early blood draw assessments. Other patients of mine have endometriosis. This is a common condition where the uterine lining can actually grow outside of the uterus and implant on some of the organs in the pelvis, commonly bowel or bladder or the ovaries. It's very painful. It causes periods that are painful above and beyond just the typical daily cramps. Another common cause of infertility is actually male factor fertility. The wonderful news is that many of our male patients have survived cancer and have grown into adulthood and achieved marriages. Unfortunately, early cancer survivors can have pretty impactful negative impact on their sperm parameters when they go to start their families and having low sperm counts. Some of our patients are smokers or perhaps are overweight, and these can also be impactful factors on causing low sperm counts, causing infertility in their patient. We welcome patients in any stage of their lives. So some of my patients are happily married. Others, unfortunately, have suffered recent divorces and are interested in conceiving on their own. For some, they just haven't found a person in their life to partner with, and they're interested in building their family as singles. For others of my patients, they have same-sex partners or themselves transgendered or have a transgendered partner. And we truly welcome people of all different backgrounds in this office. Ultimately, I think it's important to understand overall our fertility goals and the desired family size for patients. Some of my patients have very strong religious or faith-based views about what treatments are comfortable for them, and perhaps others are just ones that don't resonate with them based on their viewpoints. We support all of that, and ultimately the patient is truly in charge of deciding what next steps in treatment will be. Many of my patients have had success through either using donor eggs or donor embryos. For some women, they come to interest in family building as older women, perhaps over 40 or even over 45. And it's exceedingly difficult to conceive over 40, and unfortunately, even more challenging past the age of 45. In those patients in our older age ranges, oftentimes we'll discuss the utilization of donor eggs. The reason that those can be beneficial is they're often harvested from patients who are in their mid-20s, and therefore are more likely to be chromosomally normal, to fertilize, to implant, and more likely to cause an ongoing successful pregnancy and not result in a miscarriage. For others of my patients, unfortunately, they've undergone premature menopause. So even though their chronologic age might be quite young, their ovaries have stopped producing eggs. Now, some of these women are cancer survivors. Others have genetic conditions. But in any of these scenarios, they can still use their own uterus to carry a pregnancy, but an egg substitution utilizing either a donor egg or a donor embryo is necessary.